on general practice business sustainability. Just introducing myself, my name's Jeff Lowe. I'm a GP in Karori in Wellington. I'm the chair of General Practice New Zealand, and I'm one of the clinical leads with the Healthcare Home Collaborative. Just introducing other panel members that we have here tonight. Martin Hefford, who's the CEO of Tuora Compass Health. Welcome, Martin. And we have Nicky, who's CEO of Fielding Health Centre as well. Nicky. I'd like to, at this stage, also acknowledge the hard work that has gone on behind the scenes from two of our supporting organisations, the Healthcare Home Collaborative, and in particular Armajit Maxwell and Scott Emeris, who are with us tonight. Thank you for your hard work. And also Liz Stockley from the CEO of General Practice New Zealand for all their help in organising this tonight. And thank you to everyone who is here online tonight to watch this. Everyone's in this environment, times that we had not known before. We also have a phone a friend system. We will have question and answers after our series of presentations. If you can hold your questions until then. We also have Rob Stewart, Business Manager from Johnsonville Health Centre, joining us. And we also have Robyn Young, who is a Human Resources Consultant, who will be joining us as well. That's the array of people who will be able to answer questions on the panel after that. So, just getting into it. I don't know about you guys, but to me, it feels a bit like a disaster movie at the moment. And who would have predicted where we... In fact, Bill Gates in an interview a year ago said the biggest challenge and the biggest threat to the world economy would be a global pandemic. That's a remark he made. He didn't actually predict it. 6 months ago, I was asked to talk at the Ministry's Healthcare Forum, predicting the future for general practice and where it would be in the next 10 years. And boy, did I get that wrong. Because I didn't, and no one predicted where we would be now with COVID-19 and what effect it has had, not on general practice, but the whole world. It was extraordinary, apocalyptic, if you like, and things that we've never seen before in our lifetime, and we're having to react in ways that we've not even thought about or would have thought we'd need to in our practicing lifetimes. So what have we seen so far, and what's the scene so far? 2 weeks ago, we were told today we were going to a level 3 and we needed to change our practices, informed by what was happening in Italy, where it was evident that general practice was a reservoir and a petri dish for COVID, and we were spreading it to our patients. We were told by the college, our profession, that we needed to virtualize general morning. And the response to that was incredible. Practice teams came in on a Sunday, worked, and on a Monday we opened virtualized general practice and moved to predominantly phone consultations and virtual consultations to 70%. And I know in our practice, at the end of the week, we measured that we'd moved to 85% virtual consulting. And I'm sure most of the country operated in that way. So what did we see? We saw a tsunami of activity. We saw practice teams meeting on a Sunday. We saw practice teams coming in, converting the practice. Patients that ill patients with respiratory disease and getting the flu vaccination was streamed away from those so that they weren't in contact. We erected Perspex screens in front of our receptionists. We had guards at the door checking people's temperatures as they came in. We had to get licenses for virtual platforms. All of us knew what doxycycline was before this. They didn't know what doxy-me was, but we all know exactly what that is now. And I remember going to make my first telephone consult at 9:15 on Monday morning, picking up the phone and getting a busy tone, because we all had to increase the number of phone lines into the practice and increase the amount of minutes that we had on our phones. We also within a day, we were told we were going to alert level 4. So not only did we need to make our patients safe and our staff safe, but we needed to prepare for lockdown. So there was a huge surge in activity of patients getting ready to lock down. So in Karori, and I'm sure it's around the same around the rest of the country, there were 3 long queues, one outside the supermarket, one outside the chemist, and one outside the liquor store. So you know what people's priorities are in a good crisis. Following that, after that week, all of last week, we saw calm. We saw consultation rates drop. We saw cash flow drop to the order of 20 to 30 to 50 to 80% in some cases. We've heard stories of practices not opening their doors on Monday, doctors not coming to work, associates and locums being told they are no longer needed or having reduction in their hours substantially. How long that goes on for, I'm not sure, because I suspect there's a lot of activity waiting behind. One phenomenon we have seen is what I would call a flunami, because it's important to protect those most vulnerable in our society. And so our nurses have been inundated with doing flu vaccinations. That's if you can get your hands on the flu, because there have been distribution problems, which has affected this. So I suspect that there's a lot of work waiting behind the lockdown that will start to flow out. And already we've seen messages being out there by the ministry saying that general practice is open for business. We've not pulled up the drawbridge. We are interacting, and in fact, in more ways than we used to, keep patients safe, to keep our staff safe. And we still do see people face to face when we need to keep them safe. So, as I say, the calm that we're experiencing now, I'm sure will change. So what do we need to do during this time? We need to make sure that we protect that our workforce is still there when we emerge from this, because we're going to emerge into a brave new world. The model of care will be completely different. And we will be emerging, who knows what, how we come out of a lockdown and how long that will take, how long will be shut. But as we emerge, we're probably the longest, perhaps the deepest global financial crisis that we've known in our lifetimes. We need to make sure that general practice sustains itself in terms of workforce, in terms of its health, in terms of its stability, so that as we go through this autumn and into winter, when spring does come, there is enough warmth in those embers that are still left there to reignite and catch fire, because that's what we're going to need to do when we emerge from this. So what else did I say when I predicted would happen at that presentation? I said that the way that people would interact with their practices would change, that we would increase the number of channels by which people could interact with us. There'd be increased bandwidth. We would interact both passively and actively, synchronously and asynchronously, and that we would move more and we would face and non-face-to-face. Patient portal would become business as usual, and we would be consulting by telephone, e-consultation, and virtual consultation. So I did get that right. What I got wrong was that it wasn't going to take 10 years. It was going to take 2 days, when the urgency and the need for change was there at the moment. So the other thing that I said, and this is a shout out to our sponsors tonight, the Healthcare Home Collaborative, I also said that transformation needs transportation. If you're going to make change like this with scale and pace, you need some sort of vehicle for change, and that was the Healthcare Home Collaborative. This is wider than, and that is why this forum is open to everybody. But the Healthcare Home Collaborative and its agenda just got a turbocharger a supercharger and a full tank of gas, and it's moving with scale and pace like we've never seen before. So I'll leave you with this last thought, and that is never waste a good crisis. And we are in crisis at the moment. Let's not wallow in it and waste this opportunity. We need to ensure that we get through this crisis and get out the other side and continue to be there to serve our patients and citizens. So with that, I've just remembered I've forgotten to invite Martin to do a Karakia, and then we'll move into a presentation by Nicky, Hart.
Yeah, thank you, Jeff. We were going to, oh, it's not too late. Taku Parai, one of our kaumatua, is kind of gifted Karakia for us to use at Te Ora, and I'd just like to read it out. Whakatakata hau ki te uru, whakatakata hau ki te tonga, kia makina kina ki uta, kia mata ai, I haki ana te atukura, he tio, he huka, he hauhu, tihe Māori ora. And it's a call for the winds to cease and for the breeze to blow over the ocean. And I will. So just talking about some of the government funding, and actually I would have to say that the ministry and government been more responsive than I'd ever imagined was possible. So just take you back around the 16th of March, we were all starting to do swabbing and recognizing that it was taking a long time to do a swab by the time people put on PPE, and that it was quite the PPE and the time taken, and people having to make particular arrangements. So on the 16th of March, a letter was sent to the Director General from GPNZ, I think it was, which we all had a role in drafting. And then on the 20th of March, we got approval through a letter from Nick Chamberlain for basically funding for simple assessments and for the $250 for more complex swabbing assessments. And then around the time that Jeff was talking about, we were all scrambling over the weekend to try and put in place telehealth. On May the 23rd of March, a letter was sent to the Director General saying, look, we're all incurring additional expenses relating to putting in place telehealth and also putting in new phone lines and hiring telephonists and dealing with all this. And actually on the 31st of March, the people paid out, actually we paid out on the 1st of April, partly to help practices around end of tax year, but people should have been paid out an amount per ESU to help with those expenses. Can I just deal with a question? I'll come back. 21st of March, there was another letter. We all realised that revenue had fallen off a cliff, that with the practices going through to telehealth and with everybody in lockdown, the revenue that normally comes in had been reduced, as Jeff said, by up to 70–80%. The ministry didn't even necessarily wait for a letter in this case. We had a Sunday teleconference with the Deputy Director General of Health and with Nick Chamberlain, the DHB CEO lead, to talk through a cabinet paper which is going to cabinet this week, looking for $10 million per to general practices to recognise the loss of revenue. Now, one question that's come up is, you know, a recognition that the costs are borne perhaps most by some of the mainstream practices because they depend more on co-payments and fee-for-service revenue. And the ministry have said that subsequent payments, if Cabinet approves them, which people are pretty hopeful of because the advice is to approve them, would be made on a straight per ESU basis, not based around tiny populations, etc., recognising that the loss of revenue is a general thing. I think I was going to note, people have talked about A&Ms. There is also a business case that's gone into the government to help the accident and medical services out. And that's being considered this week by government as well. So we should expect a response on that this week. So it hasn't been perfect, but I'd have to say I've never seen kind of decision making at this speed from government before. They do recognise, I believe, the importance of general practice as the front line, both in the health sector, but also particularly in relation to COVID. Now, I'm just reminding people around the wage subsidy. A lot of people, I think, will have put in applications for this already. Available as a support for employees. You must have a 30% reduction in revenue, but that can be forecast. It doesn't have to be current actuals. If it's based around a reasonable set of what you're seeing in terms of bookings, then you can forecast that revenue drop. Associates can apply on their own behalf as well. And that subsidy is also available for self-isolating or vulnerable workers in essential services, and general practice is an essential service. So just reminding people about that clause. You do have to, I mean, if you do get that subsidy and then government does come forward with the $10 million a week and you realise you didn't need it, then you will have to pay it back, but it's probably better to apply and have the money than not apply when you need it. Now, I agree with Jeff. It's in terms of the post-COVID world, there's probably no going back. I'm sure, and I've seen one service launch since I wrote this slide a day or two ago. There will be, we have the conditions are right for a national GP service to compete with traditional general practice in the post-COVID world. The population by the end of this lockdown will be socialised to use virtual care, and GPs will be used to doing it as well. And we have currently a pool of GP and potentially available for work. What that means, in part, is that competition is going to become global. Like, people would be able to potentially outsource to anywhere in the English-speaking world. And that's something for us to consider in the post-COVID world. So we need to have a superior local, maintain that continuity of care and local clinical ownership of practices, which I believe is important. And I am going to stop sharing and hand over to Nicky.
Thanks, Martin. Over to you, Nicky.
Oh, I'll take myself off mute. That's helpful too. Well, hi everybody, and I just really want to start by acknowledging the good DPNZ and PHOs have done in the last couple of weeks, and I think that certainly our PHO and DPNZ and working in collaboration with the Ministry and DHBs have gone a long way to creating a package that I hope will get us through the next few weeks. So thank you for that. Yeah, practice, like Jeff's practice, Jeff just described his own practice, has just been turned upside down in the last couple of weeks, and we've experienced all of the things that Jeff described, as well as setting up as a COVID testing centre and also preparing to set up a community-based assessment and treatment centre. So it's been really, and so yeah, I also want to acknowledge general practice out there, and know it's really tough at the moment, and I've done some thinking about how our practice can get through the next few weeks, and that's what I want to share with you tonight, and I hope that some of it will be useful. Slide Jeff put up a little bit earlier, and for me it was certainly helpful to organise my thoughts, I guess, around the next few weeks into a bit of a framework, and which will hopefully turn into a slightly more organised plan for the practice. And the framework in my mind is in 3 parts. The fourth part actually would be right at the start, which is a big shock of COVID, and that's pushed us into this process, and we're in number 1 at the moment, which is sustain. So I really believe if we can just sustain over the next few weeks, we can move into a process of restoration and then rebuilding, and the rebuilding is going to look really different than what it did before. And I think there's some really good things that are going to come out of this, and there's going to be some extremely difficult things that we're going to have to deal with in the restore and rebuild phase. But I think the message I would like to get across, which I certainly convince myself of in our practice, is that we can sustain this, and we will sustain, and everybody should be able to move through this over the next few weeks. There's a few certainties in my mind anyway, and I think it's important to acknowledge that this is first and foremost a human tragedy, and there's going to be massive, or there is massive, devastating health consequences right across the globe, and we have been quite limited in New Zealand so far, but nonetheless this is going to be major for us going forward in terms of the economic and social impacts, even if we escape some of the health impacts. And there's major business implications, which we'll talk about now. I think one of the unique things, good things to some degree about general practice, is that we can be relatively certain that our business will return, if we can manage it at fast pace, to to 100% or more in some cases. So this is in contrast to places like Air New Zealand. I don't know if anyone saw the CEO to everybody a week or so ago, and they're expecting to only be operating at 30% in 12 months time. So that's their reality, and they've dealt with that. Ours is, I think, going to be 100% plus. The other certainty at the moment is that all the rules are out the window clinically. Well, not all of them, but there's been a lot of too in recent times that have just gone out the window clinically, business-wise, legislation. It's all changed. So if we have things in our mind that we think we can't do at the moment, those rules are all gone. So I think we can be certain about being able to do things differently. The plans we make this week will change, and plans are changing every day. Case definitions are changing. The way we are running our business is changing. So be sure that things will change. And life is definitely not going to be the same in 6 or 12 months. So we're not in a temporary, we're not sort of in this temporary state that we're just going to jump out of and be back to normal. It's just not going to be like that. And something I'm certain of is that we do have the ability to outlast this shock and rebuild general practice. And I think we can actually rebuild to be even better than what we were before. But we do need to plan for that now. So the biggest part of what I want to focus on at the moment is how do we sustain this? Just, I suppose, some tips or ideas that I've applied to our practice and hope that it will help us through. So I think it's helpful to look at a time horizon, and 12 weeks is what I've applied. The more optimistic people might go for 4 weeks or 8 weeks, but that 12 weeks is sort of a nice time horizon to just get through this, and then that will underpin your decision making. You can review and change things as you get closer to your 12 weeks or your 8 weeks, but I think it's good to set a time horizon. I think it's really helpful to implement processes in the practice if you haven't, for fast decision making. You know, things are in the business and clinically, and you need the decision makers, people who have got the ability to make decisions and delegations, getting together frequently and being able to change things really quickly. That's going to help you get through these next few weeks. It's really, really important to support and protect our employees and patients, and supporting, I think, in terms of their exposure to COVID, staff and patients are really worried about this. You'll know this, and so I think it's important that we protect them and we don't risk exposure, but also support them through that process, you know, physically and emotionally and psychologically. So this is our biggest asset, and protect employees and our patients as much as possible. The other thing I would say, if you haven't already, is grasp all of the digital health tools that you can and set them up. Set up staff with remote access, you know, let them work from home, talk to your IT companies. And in our practice, we're using Microsoft Teams, we're using paperless prescription, we were already doing a bit of virtual care, which is really good, Manage My Health video consults, you know, the whole lot, the whole range, and it's really good. And the really good thing about doing it now is that patients will be quite forgiving if, you know, the technology fails, or so you've got a bit of slack there. I think just grab them and don't be scared of them. Another thing I think that's really, really important at the moment is to communicate with your staff often about employment and health and safety issues, because this is legislation that is changing all the time as well. And again, your staff will be really worried about, you know, their incomes and their and worried as well. But I think it's important that we focus on communicating what we know and what are our responsibilities around employment and health and safety issues. So keep up to date with that stuff and communicate it often to your staff. Have meetings and, you know, hear what they're worried about. Patients, if you don't have a good communication plan with your patients, think on Facebook or what's on your website, what sort of social media are you using, what are you communicating through the portals. If you're just new to patient portals, you know, use the group messaging functions and all that sort of stuff. And again, people are going to be forgiving if you muck this up as well, so it's a really good time to have a go and get a communication plan in place. One thing that I think is really, really important at the moment, especially for smaller practices, you know, 2 to 4 GP practices, is prep yourself for an exposure situation. You don't want to get to a point where somebody in your practice is exposed, and some of you would have experienced this already, and the whole practice has isolation. So this is where you need to be talking to your neighbours, neighbouring practices, seeing what sort of capacity they've got and what would happen if somebody in your practice got exposed. What would happen and how would you manage that? In terms of the financial side, it's good timing in a way that a lot of us will be heading into a new financial year from April 1, and I think it's really important that you look at a decent budget. You know, it doesn't have to be complex, but it does need to consider what's going to happen in the next 12 weeks. So talk to your accountant and get them to do some, even if it's just, you know, build in your lost revenue and build in what you think you might get from the government, and remember, and PHOs and DHBs, and remember that the wage subsidy is about predicted loss. So if you can build, that's going to help you now. If you create a budget and build it from here on, it's going to be really, really helpful. If you're seriously in financial hardship and worried about going broke, I would definitely talk to your accountant about a liquidity monitor, because that will just give you something to refer to see whether, you know, how close to the line you're running. Look, I guess it's really about how do you get through the next 12 weeks without sacrificing staff and other important things. And you might need to just reshape some of your financial commitments. Changing the way you collect money is really important in the virtual care environment. So we immediately last week, or the week before, when we started, switched to mostly phone consultations, as started texting all of our patients on the day with our account number saying, day, great, whatever service you had, here's the account number. And we've collected probably well over 80% of that money already in our practice. So it's really important that you get systems and processes in place now for that, even if you don't have, online payment platforms. You might be investigating them. You've got the ability to text, and if you're not texting, there's heaps of companies around that will help you with that. You can automate it. You don't have to sort of text individually out to people. So use all of those mechanisms that are available. Appeal to your landlord. So we here at Hefford Karakia is a landlord as well, head tenant I should say. So we pay rent to our landlord, and we also have a number of tenants in our building that are affected by the COVID crisis. So they've appealed to us for rent relief, and we've appealed to our landlord for rent relief, and had some success with that. So that's been really, really helpful. Business continuity plan, put it in place. If you do draw on your cash reserves or borrow some money, if it means keeping your team together and you think you can do that, you should do that. Talk to your bank, make an insurance claim. If you've got insurance, that will cover it. A lot won't, but you might have some that do. And the other thing is, remember that in many communities, like our community, for example, has a really strong Chamber of Commerce and business support groups. We live in a community where, farmers and other sort of agribusiness industries have been through some really hard times, and they're used to supporting businesses, and they know how to get over really difficult humps. And I know we're not exactly that type of business. People who can offer some really good advice, so do appeal to them. They'll be really, really happy to help. Maximise support packages. We've applied for all the support packages. We think we might have to pay some of them back, but we're just making sure we've got some good systems for not for accounting for that and being clear. We might have to pay back. And I think these are I was trying to think, what would you want to avoid in this first phase around sustainability? And in my mind, there's a few things. It's just my opinion, which you can take or leave. But I think one of the really important things for general practice at the moment is to avoid the idea around winners and losers. Thinking about, is this fair for us and what's fair for the practice up the road? Because all of us need to come out of this around as winners. Staff, there's discussions around contractors versus permanent staff and who might stay and who might, might not be around at the end of it. And I think we just need to get away from the need of the people that are in general practice. We need them to be, winners at the end. Otherwise, it's practices and communities that lose out. So focus on yourself and focus keeping your own practices together. And definitely don't don't destroy your team. It's probably a bit extreme, but this is your biggest asset. Remember, we're going to be 100% up and running once we get this, and you need your team intact to get going. Otherwise, somebody else will pick them up and pick up that space. And you've put a big investment into your team and your practices, so you really don't want to lose that now. But you can be open and transparent with your teams. So, for example, our team met. Some of the team were worried about, what might happen. Are people going to lose their jobs and things like that? And we were really open with them and said that, revenue has taken a dive. Things might change, but we're not there yet. We're not going to be there in 4 weeks' time, because I know that for certain for our practice. But in 8 weeks, things might look a bit different. So I've given them a time horizon. I've been honest about the fact the business isn't great. But what we don't want to do is to kind of, walk around and complain and defeated, because that will rub off on our staff. And, they've got their own issues at the moment. We need to be leaders in this space. So don't do anything in the short term, even though you'll be, really feeling challenged. That's going to damage your ability to restore and rebuild down the line. In terms of the restoration phase, so we come out, the idea is, I'm sort of thinking that until we maybe get down to an alert 3, or people are allowed to come back to the practice, I guess. And it's really important to think, well, what is services going to look like then? Are we just going to flip back to what we had before? And for example, in our practice, people have already said, well, it's great because we've reorganised our appointments. All of the GPs do their virtual care all morning. That's manage my health and phone consultations and video consultations. And in the afternoons, the way our practice is organised is we've got 3 pods. One's a sort of red zone isolation pod, another's a pod where unwell people need to be seen acutely, and another is a sort of a things like immunisations and stuff like that. So we're doing all of our virtual consulting in the morning and all of our face-to-face, if any, in the afternoon. And already people are saying, oh, that's great, that's what we should do forever, you know. And so we're not going to just flip back to what we were before, but we will create something different. So create a plan now, even if it's just scribbling on the wall, to keep doing when you get back to normal. Don't just sort of go back to what you were doing before if there were good things that you can take forward. Do spend some time really thinking about the level of damage, you know, in your community, in your team, and it might be in your, you know, in your own circle, your own family. That's a lot to think about. And even if, you know, you just sort of scribble it down and you don't have to deal with it all, but take some time to understand it. And I think now is a really good time to get some business support from outside if you need it. You know, there's a lot of people out of work actually at the moment, and it's really, I think it's really, really difficult at the moment for the owners in particular to also be navigating this business space. So do get some help so that you can, you know, focus on the clinical side of things, and have a think about what you need to do to build resilience in your team and your business going forward. And then finally, I think this is probably things that might come out of a terrible situation, but, you know, reimagine what the new normal might look like. So I've talked about virtual consultations. We're definitely going to change the way we do that, and we're going to carry on offering all of that to our patient population. I think one thing that's really useful at the moment is to think about your business and whether it's been helpful in this situation or it's not helped. And I know there's a lot of practices that have been thinking about changing this, you know, over the last 2 to 5 years and more. If it's not helping at the moment, you know, consider why, and consider and commit to change. You know, right, we're going to change this next year. It didn't work for us here, and we know all the reasons why we want to change, and do change it. So, for example, our practice took 18 months recently to shift from a cost share arrangement, and we only just moved off that in February this year, and I just can't bear to think what it would be like right now trying to run this business under that model that we had moved, and that's been a big enabler for the business now. It's really important at the moment to have a whole of practice view of the financial situation, and in some of the models that general practice are in at the moment, it's really hard to do that because of to do and some other models. So I would definitely have a talk again to your accountant about whether or not you can get a whole of practice view, even if it's just a sort of a virtual financial model, if you like, but it's quite important to be able to piece it all together at the moment and see what's really happening. Communications, you know, how did your telephones go? How did you let the computer systems go? All that sort of stuff. If it didn't work for you, commit to changing it and improving it now. And yeah, I think, you know, other systemic changes that you've made during this period, how you carried them forward, because there will be opportunities and risks and all of that. And I guess just to finish off, I think it's really important to acknowledge that population health and healthcare as well, this COVID situation, whilst it's a public health issue, it is also why we exist. And if anybody can lead our communities through it, we can. And they look to us for leadership. So I just hope that people don't can, see the opportunities here in what's a pretty terrible situation and try to merge it in really, really good shape. And good luck. And I'm going to hand back to Jeff.
Great, thanks Martin. Thanks Nicky for those. Hopefully that set the scene for. So we're going to move into question and answers now. Just trying to move this. Can't move it to the next one. However, so we're going to move to the question and answer session now. Just a reminder, there is a chat function at the bottom of your reviews for that. So you can field your questions there and we'll look at those and allocate them to panel members. At this stage, also, I'll remind you that we are inviting on to the question and answer panel, Rob Stewart, Business Manager from Johnsonville Medical Centre here in also Robyn, who is a human resources expert as well. So just asking them to join at the moment. So just introducing Rob Stewart. Evening, Rob.
Evening.
Thanks for making yourself available for, and welcome to Robyn Young as well.
Hi, everyone.
Thanks for joining us tonight. So we've had 3 presentations setting the scene now. We're going into question and answers. We've had some that have come in already, and so I'll just kick off and feel free to answer them if you feel it's in your area of expertise. The first question was, do we need a wide discount service for supplies and services? Anyone who wants to field that? Martin or Nicky, perhaps?
Look, my first thought is that 70 to 80% of practice costs are staff related, the HR costs, and your next biggest. So actually supplies are well down in terms of your ability to cut costs. Rob or Nicky as practice managers, you'd have perhaps will either comment on that.
Probably in a might be controversial, in a wider perspective, we had our patient co-pays coming in to support us, and a large number of those people don't have anywhere near the level of support that general practice gets. So there's an element of needing to support businesses in your area so that they can support their staff who are your patients as well.
Good point, Rob. I think it is important that we remember there are industries out there who are under far more pressure than we are, and we need to be respectful of that. Nicky, did you have any comments?
No, I think, I would just support what Martin just said about looking at where the biggest I guess I was tongue-in-cheek that our expenditure on medical supplies has decreased because they're limiting the supplies that they will give us at the moment, and they're putting a blanket sort of a rationing across practices no matter what the size. So we're not finding that's a problem at the moment because we're not actually getting supplies. Our biggest problem is to get them. I don't have anything further on that other than I think there's probably other areas that we could focus on that would give us more gains or help us better through the sustainability.
Thanks, Nicky. Next question is a human resources one, and perhaps for you, Robyn. At what point can redundancy be offered when support is not forthcoming?
Financial support, I assume, from the government. It comes down to the business having a justification, a genuine and reasonable justification for wanting to propose changes to their business. So the funding obviously would come into it, and propose your rationale for that as part of the process that you still need to follow. So absolutely, I'm dealing with queries along those lines at the moment, and it forms part of your picture and part of your rationale.
Robyn, can I give you a question that's come up? You might be able to comment to leave, and someone said, many team members are wanting to cancel pre-booked leave as they can't go anywhere anyway. Now, my understanding is that employers can ask people to take the leave, but you might want to comment on that.
Yeah, if it's already been agreed and booked between their employer and employee, normally they go and have their break. In these circumstances, and I think it also depends on the individual situation, are they working, are they not working from home, etc. at the moment. So you might be on an individual basis, it might be better for the employee and the employer to agree that they take it at another point in time. I'm also of the impact on the balance sheet that this might have, and that would be something else for an employer and employer to agree. There's no hard and fast rule, and I think also look at the big picture in terms of you want to keep your relationship strong with your employees and look after them at the moment. So that might be something that does really upset them, and you're mindful to manage that carefully as well.
Great, thanks for that, Robyn. There is another question on, can some national guidelines be considered around, particularly for cremation of bodies? So one comment I would make on that is that the ministry is certainly encouraging us to get documents online, and so you can register for that with RealMe online. Nicky, I think you had some comments about that too when we discussed this earlier.
No, other than, I mean, it was really in the clinical area, but I did get, so I've had a few funeral directors send through the asking you guidelines, and there's reduced requirements to view bodies. So I think people just need to get hold of those guidelines, and I can forward them on, the stuff that I've got anyway. So there's been some quick changes that came through legislation about 2 days ago relating to viewing bodies in cremation and death. Just need to get up to speed on it, but I don't know what they are exactly.
So many things, aren't there? Yeah. Thanks, Nicky. Next question was, does the $10 million from the government supersede the wage subsidy? One comment I would make is that when we were speaking to Kariana Brooking, the Deputy Director General, on Friday at the CEO's meeting, she was this would be treated as a grant from the government or income. Although the ministry might want to give it as a grant, the taxman may see it as income, so it could be challenged. So there's no clear answer on whether that can be treated as income or a grant. I don't know if anyone else has any comments.
I think it's going to be treated as revenue, as income for practices. But there's no harm in applying for the wage subsidy. If you end up not needing it, you can stick it in your bank account and pay it back later.
Yeah, that would certainly be my approach, is go for both and. You know, the ministry support would be your kind of first line of income, I think, at the moment, and then the wage subsidy would be a bit of a backup, but it does depend on your business to a certain extent.
Another one about the wage subsidy. With the wage subsidy, if staff are not working due to health risks and would be passed on, do they get public holidays on top of this?
I'm going to guess that's one for me. Yeah, questions about public holidays, given they're coming up this week, coming through now. The wage subsidy is provided so that you can pay an employee their normal pay. That would, if they work any stat day, and that would be a normal working day for them, then my assumption, not knowing the details of that particular situation, but it would be, if that was, say, Friday was a normal working day for them, then you would be able to use the wage subsidy to pay that employee. There's a few scenarios in there that's probably the answer straight.
Robyn, any suggestions where, in a locality where people should go to seek advice on this, in terms of either signposting people to websites or actually people? What sort of people they should be asking?
There's always the employment.gov.nz website, although Yeah, so that won't, it doesn't necessarily tailor Q&As to COVID situations. There is obviously MSD, they might be putting up information. Apart from that, you can ask someone like myself. I've got a, but a lot of employer lawyers and other sort of employment related organisations, they're providing information, like all of the big lawyers and some of the smaller lawyers. I know within our region of Palmerston North, we've had quite a few updates come out. So yeah, there's lots of different places, but I do get questions. It's like, well, where do we go? And it's easier just honestly to pick up the phone and ask me a quick question, and I can point you off in the right direction if needed. But start with employment, start with MSD, and then see if that answers your questions first.
Thanks, Rob. So where you're seeking sources of truth on this at a practical day-to-day level?
Well, I haven't actually tried Healthy Practice yet, but I assume that they'll be supporting a lot of practices through this. I would give them a call as well and see what sort of support that they can help for general practice.
Yeah, and certainly I did invite MAS to tonight. Right. He couldn't because he's just absolutely snowed under with supporting members. But we do have a slide at the end of this presentation which does signpost you to the MAS Healthy Practice site, which is a good source of information on employment and all sorts of other things. Rob, have you got any secrets up your sleeve? Resources?
Places to go? No, not really. Find people you trust and ask them would be the main advice. I've spent a lot of time reading the WINS page, or MSD, whichever one it is, about the wage subsidy, because there's a lot on there to understand what they're actually trying to do. And we sort of touched on it just before. There was the thing starting today, just flagging that up about essential workers who can't work, the extra payment for that. My position on that is that you should apply for the wage subsidy for everyone that you can. And then if you have to pay it back, then go and argue for the people that you should keep that money for down the tracks. You get that money as you can. We applied last week. We still haven't been paid yet. I think their loads have increased. So, you know, when they first started, they were paying out overnight. There was all these stories about paying overnight, but I think they were fairly simple contractors claiming that money. So if you're going for a bigger claim, I'd get it in, get it on your side. No, but there are some other uses for it down the track.
Thank you. A few questions about VLCA practices, and because a lot of them receive their revenue, you know, up to 90% from capitation, they're going to find it hard to show a 30% reduction for practices.
It depends whether you're going to lose overall. If you get 90% from capitation and then the 10 million comes through, then are you actually going to be down any revenue at all? In which case, brilliant. That's fantastic.
You can't see how a VLCA practice is going to go down 30%. But as Rob said, you can still get the wage subsidy for workers that are sick or self-isolating. So that's still an option. So
I do know and do feel for some of those practices because they do run on slim margins, and it's those slim margins which are also. Just checking if there's any new questions coming through. Through now common things which have either been addressed in the presentations or with the panel. Amjad, are you aware of any other questions coming through or anything that might be useful while we've got the panel assembled?
No, I think you're covering them all off in terms of the variety that have already been answered. Attendees with raised hands, Jan White and Candice Finer. So I don't know if they want to ask a question via the chat or if they're requesting to be taken off mute. Maybe they can do that via the Q&A, and we can try and sort something.
There's one there from Robert that I'll ask because I'm interested in the answer. It's probably for Robyn. From a legal perspective, what is our position if we had booked a locum without a signed locum contract and we're no longer able to take leave and don't need the locum? Are we obliged to pay the locum or employ the locum?
And what was the answer, Rob?
Yeah.
That's why I asked it. Probably
Yeah.
not. You probably, if I mean,
Yeah.
there's no contract, you'll shoot yourself in the foot and they'll never work for you again. But
Yeah, there is that one. It's not ideal. I think because we're in exceptional times, then I think provided you have to do what you have to do, you'd probably be inclined to say no thank you to the locum. What you could do is potentially look at the contract that you'd normally offer a locum, and see what's in that and apply that termination, which I assume is a standard self-employed contract that would be, 14 days, 28 days, something like that. If that didn't suit, you just come to an agreement. But if you get a real query, a real tricky question on that, you're going to have to look to a lawyer.
Come up about tax treatment of the wage subsidy and whether you take out tax and KiwiSaver and so on. My understanding is you do. I don't know.
Yeah, so all normal PAYE deductions apply to the wage subsidy. I'm going to let Rob answer the question on income tax. Over to you.
Well, it will get taxed in the hands of the employee. It's called a wage subsidy, but the idea is that it's actually income to you and you pay them as normal. So it's their normal payroll and money because there's a whole lot of people who are not getting that income. So it's a wage subsidy if you've got nothing, if you're shutting down, at which point it's keep them employed, pay them the wage subsidy pass through. Like, if you're in a hospitality industry where there's nothing at all, it is a wage subsidy. In our it's not so much a wage subsidy. It's almost looks like a revenue top up to an extent, but obviously not at the level that the government's talking about for us at 10 million a week.
Yes, there's a question about how soon are we likely to find out what ongoing financial support will. My understanding is we'll find out on Thursday at the latest.
Yeah, so Kariana was talking about actually getting the payment out before then, but trying to get that approved by Cabinet on Thursday. So another question, how are others handling paying staff for stat holidays when we are running a skeleton roster over the Easter period?
Okay, so if you've got a skeleton roster and someone's working, they would be paid their normal pay, and time, those time and a half and a day in lieu, those rules all still apply, I believe. All the other normal employment obligations do, so I don't see why that one would not. If someone isn't required to work, not their normal day of work, then they wouldn't be paid for the stat day. Is there any other scenarios that are likely to come up? Working, not working.
That probably covers most scenarios, I would have thought.
Yeah. If there's anything specific, feel free.
Sure. Next question again for you, probably Robyn. From a legal perspective, what is our position if we had a previously booked a locum without a signed locum contract and we are no longer able to take leave? are we obliged to pay the locum or employ the locum?
Sort of similar to the one that was asked just before.
I think so. Yeah.
Yeah, I think it's a tricky one.
Yeah.
I mean, you've got, and it's a different set of, it's not employment law, it's more commercial law. So it's not, yeah. Again, you're going to have a conversation. I think being practical, have a conversation, explain what the situation is, and hopefully it goes reasonably well. And you would have think that a locum would be able to pick up other work quite soon in the current circumstances. So hopefully that would be smooth.
There's also
an interesting one for you here. As a solo GP over 60 with a particular health condition at risk from COVID, can I ethically, professionally refuse to see someone? What do you think?
Yeah, look, that's a tough one, and I think it comes down to personal preference. I know people in that situation who wouldn't, know people in that situation who would. Look, I suppose in these situations, and it's similar when how do you treat your locums and associates? It's about respecting people's vulnerabilities, and just ensuring you're respecting that. I don't think there's any hard and fast. Certainly, it may limit their employment opportunities if they're not business owners. Getting back to the locums and associates one, I would say as we set up more CBAC, as CBACs need more medical capacity for assessment, there is possibly work available for people on those sites as well.
Just talking about those associates, I'll just jump in. I don't know what position everyone's taking, but it sounds like in some cases, we've got larger practices. As an example, you've got the shareholders who are protecting themselves, but it's knowing that those associates are also probably the future of your business and the person that you're most likely to sell to. So it's another thing of keep your team that Nicky's talking about. Don't you shoot yourself in the foot. And I know that, quite a lot of the older GPs know that they are in a different position than the younger ones who have either just made a big contribution to buy into a practice that's now struggling, or young families, or all that sort of things. So I'm sure there's a lot of goodwill around.
Yeah, we've got 3 new shareholders from the 1st of March, literally young associates who bought into the business, and this is their first month in practice as a GP owner. So so we're going to try really, really hard to look after them through it.
Yeah, we have but boy, have they stepped up. But becoming a partner or a business owner in this time does actually give you some certainty over your job. Yeah. So whilst they may have recently taken large loans, it also gives them job security.
Question at the top that I want to address from Kat around the suggesting there's no medtech codes applicable to telephone COVID-related consults. Just 2 things on that. The telephone-related consults, Healthcare Home Collaborative have got a really good set of codes that I'm sure you'll be able to get from Amajit or from your PHO. Will help you code telephone consults and telephone triage. And then for COVID-related activity, I mean, everybody will do it differently, but I think it's important to track any extraordinary activity. And the way we've chosen to do that in medtech is we've set up a patient account holder as COVID. We are doing things like COVID testing and kind of extraordinary COVID-related activity. We are billing that to that account holder so that we can go back and see it. Because we may want to invoice that to somebody at some point, and we definitely want to track what all that activity was. So that's one way you can do it anyway.
All right. To answer, we've fielded most of the questions to this point. Unless there's any other questions between the actual panelists themselves while we've got you all assembled, we might draw this session to a close. I'm just going to go back and hopefully I can share. No, for some reason I can't move this screen on, but in the presentation, which is available, we have signposted people to various websites and resources. Some of them we've mentioned before. There's the Healthcare Home Collaborative's website, and in particular the model of care. And I would say a lot of the model of care described in the healthcare home, as I say, has been given a boost by this current crisis, and the new normal will look quite a lot like what healthcare home. There's the MAS website. Oh, thanks, Amajit. The MAS website and Healthy Practice. So, as I say, Sean Phelan from MAS gave us apologies for tonight, but has signposted people to that website where they can seek information. The website, which has a particular article there on telehealth, and there is the telehealth.org.nz website as well, offering advice on there. So look, with that, I want to thank everyone for attending and the information that you've shared with everybody this evening. Martin, did you want to close with a Karakia as well? Or no?
No, I'm fine on that. I don't have one in front of me. We usually close with a song, and I'm not sure I want to lead you into a waiata.
Fair enough. Look, you've Martin, so we'll let you off there. So look, again, thank you to the panelists. Thank you to Amajit and Scott and Liz for all the work behind this webinar tonight. It has been recorded, so it is available. Thank you to everyone who's attended tonight. There is comfort in information from a common source, and nice to see so many people join us tonight. When you leave this webinar tonight, there is no sport that you can go and watch tonight. Everything's shut down, even NRL in Australia. We're used to seeing the heroes in our society being sports stars and being paid huge amounts. To you, the heroes are the ones who are working now. The people who are running, keeping our power and water, streets clean, stocking the shelves at the supermarkets, and also everyone who has attended here tonight. You and your practice teams, the PHOs who support you, are the true superheroes. And so when you attend work tomorrow, you put on your gloves, your masks, your PPE. Don't forget to put on your cape as well, because you guys are the superheroes. And thank you for everything you're doing. So good night, and thanks for your attendance tonight.